So the primary reason why I was trying to keep everybody on time so that we would have a few minutes at the end to open up for questions. And certainly this is the place where the rules that Dr. Azeem had set out at the front are in play. My one request is to use the microphone so everyone can hear your questions, and please address your questions to the abstract presenter, and we'll get the abstract presenter up here at the podium to answer your questions.
Well, the first one is, how do you rationalize saving life, as we said with vaccines, with the my understanding of the Islamic belief that life is predetermined? And the second question is, if we accept, or if the school accepts that you can take vaccines that contain pork, will we ever get vaccines that don't contain pork?
So the questions, I think everyone understood. I just wanted to repeat them according to my understanding. So you're asking the concept of vaccines in saving life when life is predetermined. So this goes back to seeking medical treatment in general, and this is a discussion probably for a much higher intellectual level of understanding. But the Prophet ﷺ was reported to have said, everyone is supposed to do it to the best of their ability, because kullu muyassarun lima khuliqa lah, that everything is made easy for which you have been created. So the doing is up to us. The predetermination and divine destination and decree is up to God. So we have a part to play in that. I don't think those lines need to be crossed in terms of understanding or application per se. That could be very simple and oversimplified answer, but that speaking to the second part, I think we brought up the aspect of the ingredients in vaccines and the whole pharmaceutical industry. Dr. Arozullah is an expert in that field, but that's not what the paper particularly was about. But since you're asking, that's a subject that is open to many views in terms of what the industry has its sights on in terms of profits and whether they have the best interests of the public in mind. But as far as individual consumers of healthcare, I think the decision comes down to everybody making a rational decision based on a level of scholarship and expertise, medical expertise that they trust. And it's not that we're being inoculated and everyone's going to be left to the ploys and the scheming of the government. That's one theory, but the other theory is that there is some benefit. We're trying to live up to the most practical and most relevant aspects of it. So again, not everything's bad, but not everything is considered a wholly good. So,
Dr. Ebrahim, would you like to comment on the aspect? I think the brother's question also is asking that if we are to accept porcine components to a vaccine, where would there be any incentive? If I'm understanding the question, when would there be any incentive for industry to find a non-porcine alternative?
A good question, but if you allow me, can I respond to the first part?
Please.
You see, the question that the brother asked is, if we believe in taqdeer, he's actually saying, so what's our role to play in saving lives? Now, if you look at the ayat of the Quran, أعوذ بالله من الشيطان بسم الله الرحمن الرحيم فَمَا أَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. Whoever saves a life, it is as if he has saved the whole of humankind. So Allah subhanahu wa ta'ala, or God Almighty, has created us and created us to be instruments, His instruments. So if we can, it is up to Him whether the person will survive or not. But we must try every attempt for us to save lives. This is, but when you speak about taqdeer and so on, it is in the foreknowledge of Allah that whatever you're going to do, if he's going to die, he's going to die. But we don't know. We have to do our best, and this is what your professions actually help you to have the belief that I'm doing my best and that person will survive, Remember the hadith of the Prophet ﷺ, which says that when Yawmul Qiyamah, if you know it's tomorrow and you have a seedling in your hand, now it's life, go and plant it, because we don't know when it's going to come. Okay, and now the other question is a very good question. That's why I say it's not absolute, the laws of necessity, the darura. It's not absolute. So it means that we have to tell the people, the scientists and so on, that this is a problem with us. So we'll accept that, but it must help you to go beyond using porcine elements in vaccine. So it won't stifle the people to think in the line, how can you use substitutes and so on. Shukran.
My comment is for all three speakers other than Syed Jafri, who talked about legal principles. I've been teaching Qawaid al-Fiqhiyya for a couple of years, and what I see missing in your presentations and in your framework is any mention or appreciation of taqlid or legal precedent. In other words, the jurists who formulated the very principles you cited never thought of these principles as sort of free-floating principles. They saw it within the framework of revelation and within the framework of the precedent of the school. So the teaching of Qawaid is basically involves teaching all the exceptions to the Qawaid. So we have to have that appreciation that these Qawaid are not free-floating and they are within the framework of legal schools, at least in the perspective of those people, of those jurists who articulated those precedents. And secondly, again, what I found missing in your presentations, all three of you, is a very central Islamic concept, which is tawakkul. And that's also something that's taken into consideration. We're talking about removal of darar. There are sound hadith from Prophet ﷺ where 6 people came to him and asked for him prayer, and Dr. Azeem narrated one of these hadiths at the bioethical conference in Houston, where the Prophet ﷺ told them, if I make a dua, you will get cured, but it's better for you that I don't make a dua and you show patience. So I think in again, using these qawaid or these maqasid, you have to take into consideration the precedent of the legal schools and also the central notion of tawakkul.
Thank you.
Thank you very much, brother, for some input and suggestions. Yes, I intentionally limit my discussion to the concepts that derived by Muslim jurists. For example, actually is designed for mujtahid, for the one who do ijtihad. So the discussion of taqlid is not included here. For general understanding, there are 3 kind of activities that you can, base your action from. For example, for lay people or for fellow mujtahid, they can do first taqlid, which is just follow the rulings without knowing, for example, without knowing how that kind of ruling is derived from legal sources. That's kind of taqlid. But ittiba, you know the lines of reasoning of that kind of ruling. But what I'm discussing in my paper is that how, yes, the tools and the principles and the modes of reasoning are there, how we use them. For example, to encounter cases that are not equivocally, not univocally, not nassan, laisa nassan min al-Quran wa sunnah. And this is because not all problems, for example, the contemporary biomedical ethics problems are not treated nassan from the Quran and sunnah. So that needs our discretion, legal discretion, especially for those who are expert in legal scholarship. Yes, qawaid are not free-flowing maxims. There are also some limitations. There are dawabit. There are borders that you cannot cross. For example, if it's conflict with the textual injunctions, it should be eliminated. So dawabit are there as well. So thank you.
Professor Ebrahim, you wanted to respond to the question as well.
Shukran, Sheikh, for your observation. Anyway, Now, as far as the first part is concerned about the hadith, the Sayyidina Muhammad ﷺ said, it's better that I don't make dua. But then you have so many other hadiths in which say, if I'm sick, should I go to a doctor? And he says, yes, you must go to a doctor. So you must look in the broader context and so on. So not necessarily, I mean, the hadith is very wide, and we can find things supporting this side or the other side. All right, and coming back to the question of taqleed. You know, when we talk about yesterday, I think we talked about ijtihad, the doors of ijtihad being closed and so on. But I believe that within the schools, the mazahib, the doors of ijtihad was never closed. You know, when you look at Imam Abu Hanifa, rahimahullah, what happened is that his students, you know, disagreed with him. And in many occasions, the rulings of the students took priority over that of the ustad. All right? So now, as our brother pointed out, you know, there are certain new problems that we are faced today, you know. So we try, they should not go against the nas of the Quran, but as long as it doesn't go, nothing stifles us to make ijtihad within that particular school and try to come to solutions that are necessary to be for our benefit. And the last part is about tawakkul. You know, that the question of tawakkul and so on. So now this is, you know, every Muslim, you know, has tawakkul in Allah subhanahu wa ta'ala. But the question is, that tawakkul should not make us lose faith that Allah subhanahu wa ta'ala will either assist us or not assist us. You know, it should not make us stop doing something. We place our tawakkul, but then it should not stop us from doing something that we feel, oh no, I shouldn't have done that, it was against tawakkul. So my iman will be weak, you know, I must resist all the pain and so on. I mean, if you look in end of term diseases, then the fuqaha are happy with it, that we should give painkillers for that.
Last question.
Assalamu alaikum. Thank you for the presenters and thank you for the organizers. It's a great meeting compared to last year, which was my first meeting. My question is to Dr. Ebrahim about his topic, which is very critical. So I saw in one of your slides a reference to suicide. And my question is, there is a distinction between the person's right to defend themselves, even if it is, or his family or his wealth, even if it is not really sound like it is reasonable, or kind of the means that they have may not be sufficient. So I want your comment on that piece, because I don't think suicide belongs in here. This is more of a personal assessment of what they would do to save themselves, but also there is the other side and the understanding that you do not throw yourself to what will destroy you, which is in the text, وَلَا تُلْقُوا بِأَنفُسِكُمْ إِلَى التَّهْلُكَةِ. So I would like for you to really make the clarity of that concept, because I don't think suicide is part of it. It's more of how you assess your abilities versus the means that you have. Thank you.
Shukran, ya akhi. Now, anyway, I should not have used the word. When I'm using, I use it loosely. Suicide, loosely. Yeah, you know, I didn't mean that we have no right to end our life. You know, we have no right to end our life as Muslim. But I'm just talking about in a situation. You know, if you come to South Africa, perhaps you'll appreciate what I'm trying to tell you. You know, when you are right there, and then you have nothing, you have only one car, and you're already thinking that if I lose this car, I'm going to get a replacement. You know? So I'm talking about in that context. So please understand and trying to understand. This is what I'm looking at it. And we go to the hadith which says, I know it's impossible, but people go to the extent because on the spur of the moment you're thinking that I'm going to save my property because I need to transport my children to school and so on. So in that context, so please, I ask Samihni, you know, if I have offended you in any way. Shukran.
Jazakallah khair. So just before we end this session, just maybe a couple of thoughts to share with you as you're listening to these presentations. I think one theme that I see running through all of this is almost an element of desperation for Muslim health practitioners, or everyone trying to find the way to bring their iman, their faith, their Islam to bear on issues that they're facing on a daily basis. And I think there's very little to doubt the sincerity of everyone's effort to do that. And I think the other thing that you'll appreciate in all of these presentations is it is a great amount of struggle to come to these ideas. This is not an easy task, what we're talking about. And often when we go out in the community and we present on bioethics, the practicing physician often wants a one-word answer. Is it a yes or a no? And I think if there is one lesson I want you to take from the next couple of days as you're watching these, is to appreciate that there's tremendous subtlety, there's tremendous principle, and there's tremendous amount of effort that needs to be put forward before we could even come close to saying yes or no. And certainly I think these 4 abstracts reflect that in very different ways, but that's one theme. The other theme that I find that is a challenge here is who has the authority to make these decisions? And so in the context of California, when the legislature has put out a law, the part of the discussion is Islamically, what do we do? The other part of the discussion is we're a citizen of California, how does that affect us? I'm not, fortunately, but let's say if you were, how does that governmental level of authority affect things? If you're a pharmaceutical company trying to make money, how does that affect your view on porcine materials, which by the way, I'm not an expert, so don't blame me for the porcine in your vaccines. But these types of issues are hopefully the food for thought that we've presented in this session. May Allah reward all of our presenters tremendously, grant barakah to their families for all of their efforts in this realm and to help bring knowledge and to shed some light on these issues. Jazakallah khair.